Here we go. Thank you, Chairman Guthrie. Good morning, everyone. Thank you to Dr. Fowler for being here today. The Center for Medicare and Medicaid Innovation was created to help improve how Medicare and Medicaid pay for health care and to be an engine in our drive towards value-based care. CMMI was given a 10-year, $10 billion budget and an extremely wide-ranging authorities with limited built-in congressional oversight. The only directives Congress gave CMMI were to achieve two goals: lowering the cost of delivering care and improved patient outcomes. Over the last decade and a half, CMMI has tested over 50 models. Only two accomplished both those goals. When CMMI was created, the savings it was projected to generate were to be used to offset spending by the Affordable Care Act. Originally, CBO estimated that CMMI would save $1.3 billion over its first decade of operation. That same model also projected CMMI would save as much as $77.5 billion in its second decade, from 2020 to 2023. However, when CBO looked at the actual results in a September 2023 report, the disparity between those expectations and the reality proved to be staggering. Instead of reducing spending by $1.3 billion in the first decade, CMMI increased spending by $5.4 billion. For the second decade, instead of saving $77.5 billion, CBO is now projecting CMMI to increase spending by $1.3 billion. I have a hard time believing any objective observer could look at the results thus far and describe CMMI as a success. So how do we move forward? Today, we're joined by Dr. Elizabeth Fowler, the current director of CMMI, to discuss the center's work and understand why it has failed to live up to the intended purpose thus far. I will note, Dr. Fowler has not been with CMMI throughout its entire existence. In fact, CMMI has had multiple directors across multiple administrations. But you are at the helm now and responsible for correcting this program's trajectory. And while there are still some reasons for optimism, a lot of what I've seen is concerning. I've been disappointed to see CMMI devalue drugs approved through the FDA's accelerated approval pathway, which FDA leadership confirmed meet the agency's gold standard just a few weeks ago in front of this committee. This pathway was designed to build on precision medicine, encourage innovation, and allow patients to access needed cures sooner. But CMMI's decision to cut reimbursements unilaterally for drugs approved via accelerated approval undercuts this mission. In addition, when Congress passed MACRA, thanks in large part to the work of this committee, CMMI was given a central role in driving Medicare's transition to value-based care. While CMMI has developed and tested some new models, largely for primary care physicians, too many clinicians have been left without a pathway to participate in APMs. I'm concerned that instead of focusing on fulfilling the role Congress gave CMMI in MACRA and working on developing new APMs, CMMI's focus has shifted to collecting information on patients' food insecurity and housing needs and requiring providers to waste time writing ridiculous health equity plans. While I have concerns on the overall direction and lack of results with CMMI, there have been a few positive outcomes that deserve to be recognized. Looking at CMMI's most recent work, I'm glad that you're continuing to build on accountable care organization model. While joining an ACO should not be the only pathway for providers to be able to participate in value-based care, these models are among the few that have actually managed to reduce overall spending and should not be abandoned. I was also encouraged to see CMMI work on trying to improve the care for Alzheimer's and dementia patients. Sadly, most people know someone who has suffered from this terrible disease, and I hope that this model is successful in improving community-based care for those patients. Lowering the cost of health care in this country has been the primary mission of this committee, this Congress, and we're on an unsustainable path and must continue to find ways to reverse the current trend. It makes it all the more important that CMMI carries out its intended mission and advocates pursuing an alternative agenda and avoids and avoids pursuing an alternative agenda. I'm grateful you're here today, Dr. Fowler, to share your expertise and eager to learn what lessons CMMI has learned and how we can get back on track with the mission and the directive that has come from Congress to CMMI. Thank you, and I yield back.
Thank you. The chair yields back, and the chair recognizes the ranking